Each year, the Philippine Cancer Society encourages smokers to quit smoking. Known as the smokeout, the event helps smokers understand that quitting, even for just one day, is the first step in becoming healthier. The diseases caused by smoking harm almost every organ in the body. It is the cause of 1 in 5 deaths in the Philippines alone, yet around 42 million Filipinos continue to smoke. Find out more about the different diseases that are caused by smoking and learn the steps necessary to quit smoking today. With tobacco use remaining the largest preventable cause of disease and premature death in the Philippines, the health benefits of quitting begins immediately. 1. Lung cancer. Smoking dramatically increases your chances of developing lung cancer. According to the Philippines Lung Cancer, men who smoke are 23 times more likely to get lung cancer and women who smoke are 13 times more likely. Non-smokers are also at risk of developing lung cancer. A non-smoker exposed to secondhand smoke has a 20 to 30% higher risk of developing lung cancer, and secondhand smoke causes 7,330 deaths a year. 2. COPD. Smoking is the cause of 9 in 10 COPD-related deaths. This umbrella term, which includes emphysema and chronic bronchitis, is the number 3 killer in the Philippines. The Philippine Lung Cancer indicates that smoking during childhood and teenage years slows lung growth and increases the risk for developing COPD. 3. Heart disease. People who smoke are 4 times as likely to develop heart disease than those who do not. Nicotine in cigarettes reduces the amount of oxygen your heart gets and also raises your heart rate, putting more stress on your heart. 1 in 5 deaths from heart disease are related directly to smoking. 4. Stroke. Smoking doubles the risk of stroke. According to the National Stroke Association, smoking causes a lack of oxygen in the blood and makes the heart work harder. This makes blood clots form more easily, and then the clots can block blood flow to the brain and cause a stroke. 5. Aortic aneurysm. The aorta is the largest blood vessel in the body. Aneurysms are more common in men than in women according to the Philippine Medical Association Health Guide. It has been shown that the risk for an aortic aneurysm increases even more in men who smoke. 6. Oropharyngeal cancer. This type of cancer starts in the mouth or throat. The risk of developing it is directly related to how much someone smoked or chewed. The Philippine Lung Cancer Society says that this cancer can affect the voice box, lips, inner surface of the lips, cheeks and gums. 7. Esophageal cancer. This is cancer of the throat. The National Cancer Institute states that smoking increases the chances of developing esophageal cancer. Squamous cell carcinoma, or cancer on the lining of organs or the surface of skin, is linked directly to tobacco and alcohol use. 8. Cataracts. This ophthalmological condition occurs when the lens of the eye becomes opaque over time and vision is lost. According to the Association for Research in Vision and Ophthalmology, it is the leading cause of blindness and the risk of developing it is increased by smoking. 9. Type 2 diabetes. Around 90% of diabetes cases are type 2 diabetes. Smoking is a direct cause of type 2 diabetes. Smokers have a 30 to 40% increased risk of developing it. People who develop diabetes and continue to smoke are more likely to have trouble controlling their disease, which may lead to increased chances of heart disease, ulcers, infections and amputations. 10. Rheumatoid arthritis. It has been shown that smoking increases your chances of developing rheumatoid arthritis. The Arthritis Foundation cites a study that centered on the connection between the two. Rheumatoid arthritis causes inflammation in the joints, pain, deformities and immobility. 11. Sudden infant death syndrome. SIDS is the sudden, unexplainable death of a child during sleep. It occurs between the ages of 1 month and 1 year. Studies have shown that mothers who smoke during pregnancy put their babies at a higher risk for SIDS. A study published in the National Library of Medicine explained that mothers who smoked prior to pregnancy have the same increased risks as mothers who smoke during pregnancy. The risk is even higher if the father also smokes. 12. Erectile dysfunction. Many studies have found that smoking is a major factor in erectile dysfunction. Smoking causes plaque buildup in the arteries and obstructs blood flow. In one study, men who smoked more than 20 cigarettes a day had a 60% higher risk of developing erectile dysfunction. What do you think? Please comment down below. If you want to hear for more, please subscribe to my YouTube channel.